All right, welcome everyone. Thank you for joining us for today's workshop. Just a little housekeeping before we get started here. If you have any questions during the presentation, please type them into the question box, the Q&A. It will be monitored and we will try to answer as many questions as possible. There will be time for questions for our speaker at the end of her presentation, and please stick with us to the end to hear stories and experiences about accessing home and community-based services, and share with us your opinion about the proposed rule. Now, without further ado, we'll turn the time over to Yossi Burks-Abbott.
Good afternoon, and thank you for joining the Creating Community Commenting on the HCBS Access Rule Workshop, co-sponsored by the Autism Society of America, the National Association of Councils on Developmental Disabilities, the Association of University Centers on Disability, and the National Disability Rights Network. My name is Yossi Burks-Abbott, and I am pleased to kick off this workshop. As an autism self-advocate, I wear many hats: writer, public speaker, advisor, educator. Most importantly, I bring my lived experience to all these activities. For self-advocates, this workshop will challenge you to learn more about the policies that impact your independence and participate in creating those policies. Today, we will talk about access to home and community-based services, and learn about what the federal government is doing to hold states and providers more accountable to people with disabilities who rely on HCBS to live, work, and be part of the community. The second part of the workshop will ask you, the audience, to share your opinions and stories about the current HCBS system and comment on the proposed changes. Finally, you will be taught how to advocate for the proposed rule by using a new advocacy toolkit developed for this workshop. Remember, you have a role in creating community by letting the federal government know your HCBS story and whether the proposed solutions in the HCBS access rule work for you. It is my pleasure to introduce Vicki Goddich, Deputy Administrator for Policy and Evaluation for the Administration on Community Living, also called ACL. ACL was created to build systems where older adults and people of all ages with disabilities should be able to live where they choose, with the people they choose, and with the ability to participate fully in their community. ACL has taken the lead in advising other federal agencies on the importance of home and community-based services. Ms. Goddich will share with us exciting new information about how federal agencies are proposing to hold states and providers more accountable to people with disabilities who face obstacles to HCBS services. As a reminder, if you have any questions for Ms. Goddich, please type them into the question and answer box on your Zoom toolbar. Welcome, Ms. Goddich.
Good afternoon, everyone. I am really excited to be part of this presentation and talking to you. I want to reiterate, I want to keep saying that your voice is very important. The government needs to hear from you about your experience with home and community-based services and how this rule may help you, or if it doesn't help you, what else might be able to help you. So let's go to the next slide. Who is ACL? We are part of the big Department of Health and Human Services. We were created in 2012, and as Gassi said, our mission really is to ensure that people with disabilities of all ages and older people can live, work, play, worship, really join in the community setting of their choice, and most importantly, receive the services that they need in the community settings. I'm going to be talking a little bit about the what's called the access rule that applies to home and community-based services, and then I'll be taking questions. So next slide. Again, our mission is to support community living for people with disabilities and older adults. We work throughout the government with other government agencies to represent the voice of people with disabilities and to make sure that your voices are heard. We work very closely with the Centers for Medicare and Medicaid Services, or CMS, which is another agency within the Department of Health and Human Services. CMS is the agency that oversees the Medicaid program. And the Medicaid program is also provided to individuals through the state. So CMS works with states to make sure that people who are eligible get the Medicaid services that they need. CMS recently issued a proposed rule called the Access Rule, and that's what we're going to be focusing on today. It's called the Access Rule because the idea and the goal is to help people to get access to the services that they need. Again, ACL and CMS work very closely together on issues impacting people with disabilities and older adults. We work particularly closely around making sure that people could get services and supports that they need to remain in their home. Next slide. So the Medicaid program and home and community-based services, what do we mean by this? You may not know the term HCBS, but HCBS is really the healthcare, the mental health services, the supports like employment supports, or people who can come assist you with things like cooking or shopping or getting out of bed in the morning. These are the supports that people need to live fully in the community. So how does the HCBS rule work with state governments? So the state governments and the federal government work very closely together. The federal government proposes rules to make sure that the services that people need are available to them. And then each individual state designs how those services can be provided. In other words, the federal government sets the standards and makes sure that states follow those standards. Next slide. I'm going to try and describe this a little simply. For many years now, ACL and states and self-advocates and DD councils and all the sponsors of this organization have been working to ensure that there are standards for people to be able to receive services in the community. And this is what the HCBS settings rule does. It helps establish the standards and the rights that people who are getting the services receive. Some of the standards, and you will hear about them, include person-centered planning. They include the right to have visitors. They include the right to have a locked door in your room. They include the right to have access to food when you need it. And again, these standards apply to Medicaid services received in what's known as community-based settings. Those standards have been around for a very long time, and states are at the point of making sure that those standards are being met. In the meantime, to provide more information, CMS has issued a proposed rule that we call the Access Rule. It's proposed because the federal government is looking for people who receive those services, people who provide those services, states and others, to comment to make sure that the standards are being met. Some of the things that the proposed rule talks about are getting access to direct care workers. Many of us know that it's sometimes hard to get the workers that you need to provide the services that you need. There are proposed rules that address person-centered planning, and you will hear about some of the problems with person-centered planning later on in the presentation. The proposed access rule actually tries to promote health and safety of people who are receiving community-based home and community-based services in community settings. The proposed rule wants to improve access to the services, and the proposed rule wants to make sure that there's more information available to you and to other people in the public about the services that are being provided and whether these services meet the standards and whether they're good services. Next slide, please. Okay, so the access rule has a number of components. One is the workforce compensation. How can we pay workers who provide the community services and the supports that people need? How do we know how much they're being paid? The second component is the access to home and community-based services. How do we know that people who need these services, who are eligible for these services, are able to get it? Another component addresses person-centered planning. And person-centered planning is the plan that you help develop with your Medicaid workers that discusses what's important to you as well as what's important for you. The rule talks about how to get information if there's a critical incident, meaning if somebody is injured or something bad happens. How is that reported and how is that being addressed? And then suppose you're unhappy with your services. They're not the high quality. You're not getting everything you need. How do you make that information known? How do you file a grievance so your problem can be fixed? And then the final component of the rule talks about quality. How do we measure what the quality of the services are? Next slide. So this slide is really kind of difficult and it's kind of complicated, and it's really not necessarily something that you would want to comment on. But the important thing to know here is that the proposed access rule requirements apply to all the different ways that a state can be providing someone with home and community-based services. And as you see, there are 1, 2, 3, 4, 5 different ways that states can use to provide a home and community-based services to people in their state who are eligible for Medicaid and eligible for home and community-based services. And so it's important to note that the access rule applies to all of the different ways that you can get home and community-based services through Medicaid. Next slide. Excuse me for a moment. One of the issues that we all have seen and heard about is that there are not enough direct care workers to provide the assistance and the services that people need to be able to live in the community and participate in the community. And there are a lot of ways in which the access rule tries to address promoting the interest of people to be direct care workers and to make sure that direct care workers are paid with a commensurate or equal to the work that they do. And so this gets a little tricky. The important thing is that the rule would require states to make the payment rates known. So people would be able to see how much workers are being paid. Are they being paid sufficiently that they want to take the jobs, that they can live in the community? The rule proposes that there would be a regular review of payment rates. So what do the payment rates look like 5 years from now, or 5 years after the rule goes into effect? Have they been increased? Are they keeping up with inflation? Are they, if they might have been enough to support a worker when they were first established, but maybe 5 years from now, they are no longer enough. And the rule also provides what is called a minimum percentage requirement of 80%. In other words, for every amount of money is a sufficient that a provider receives. Is a sufficient amount of that money going to pay for the direct care workers who are providing the services. Next slide. In a lot of states, there are actually wait lists to get home and community-based services. And wait lists can work in a number of different ways. A state may say to you, we can no longer accept applications for home and community-based services because we have too many people who are receiving those services. And we don't have enough people to provide those services. So come back and apply later. Or a state can say you're eligible for those services, but we're putting you on a waiting list to get those services because, again, we don't have enough people to provide the services. And in some states, what is HCBS? Home and community-based services. Thank you for asking that question, Ashley. HCBS, home and community-based services, are the services you get to stay at home, like the employment supports, the assistance with eating, getting out of bed, dressing, bathing, the assistance with medicine, the assistance with shopping, the assistance with doing chores around your house. Another way that states can create waiting lists for home and community-based services is to say, well, you are eligible for services. You would be eligible for 40 hours of an aid service each week. We don't have enough people to provide you the 40 hours of aid service each week. So we're only going to give you 20 hours of that aid service, and we'll put you on a wait list for the additional 20 hours if we get more workers to provide that. So what the access rule is proposing is that states keep track of and report on their wait lists. How do they maintain the waiting list? Do they say, no, we're closing eligibility? Do they say we're putting people on a waiting list you're found eligible, but you'll get services once we can serve you? Do they limit the number of hours of services that you get? How do they decide if they're going to serve some people right away and other people put on the waiting list? So they'd have to keep track of that and report that. The state would have to report how many people are on the waiting list and how long they stayed on the waiting list. If a state puts people on a waiting list and provides them some of the services and not all of the services, how long do they have to wait for those services? And if they're giving you only a small part of the services that they think you're eligible for, what's the percentage? Are they giving you half? Are they giving you a third? Are they giving you a quarter? Are they giving you 2 hours a week when they really think you should be getting 40 hours a week? So states would have to keep track of that, and they would have to provide that information and report that to the federal government and to the public. Next slide. Person-centered planning. At HCL, we do a lot around person-centered planning. Person-centered planning, as I'm sure you may know, is the plan that you set up with your caseworkers, with your healthcare providers, with a number of people that talked about not only what are the services that—
I'm sorry, Vicki, we've just lost your audio.
Oh, okay. Can you hear me?
We can hear you now, but we lost the last two sentences.
Oh, okay. Person-centered planning is the plan that you work on with your healthcare provider, with your caseworkers, that talks about not only what are the services that you need, but what's important to you. So, for example, it may be important for you to take a walk every day and stop and smell the roses. That would be in your person-centered plan that you would, and you may need somebody to assist you in going on that walk. So again, your person-centered plan would say, Vicki wants to take every walk each day. And she wants to, she needs somebody to help her to go for that walk. So in looking at what the services she needs, she would need somebody to assist her to go for that walk. The example I always like to give is that my husband's person-centered plan would say that he needs a cup of coffee as soon as he gets out of bed in the morning. My person-centered plan would say, Vicki needs to wait a little bit before she has food, but make sure to give her black tea that's unsweetened a couple of hours after she's gotten up. So there are lots of problems with the way that states have been implementing person-centered planning. There's been problems with some providers and how they implement person-centered planning. And what this rule is proposing is that states must reside the plans. Each year based on their annual assessment. I just saw an interesting example in the chat about a person-centered plan wanting to live on a farm and the state saying no. That is an interesting concern that if a person-centered plan was being reviewed, the state would have to consider, what does that person-centered plan mean for that individual? Next slide. Okay, reporting and addressing critical incidents. Critical incidents are things that might happen to you in the setting, or things that might happen to you in a provider's care. Suppose the setting doesn't provide assistance with walking downstairs, or is not accessible, and somebody falls down the stairs and is hurt. That would be a critical incident. So that incident would have to be reported. And what this proposed rule would require is that a state maintain a system to report electronically through a website, through the internet, information about the critical incidents. They'd have to identify what the incident is. They would have to explain who was injured, what the setting was, and the states would have to look at the reports. They'd have to create different priorities for the reports. They'd have to investigate the reports, and they'd have to solve or resolve the reports of the incidents. And then they'd have to keep track of trends. So if they see, for example, that a number of people keep tripping over a broken sidewalk in front of a particular home and community-based setting, they might want to work with the provider to fix the broken sidewalk. The proposed rule says that the states must set their own timeframes for setting up this system. Next slide. I talked a little bit about what is a critical incident. This slide talks a little bit more. It could be physical abuse, verbal abuse, sexual abuse, psychological or emotional abuse. It could be neglect. Somebody forgets to feed an individual receiving services. It could be financial exploitation, meaning somebody steals somebody's money. It could be using seclusion, meaning keeping people separate, or using ways that really should not be used to provide assistance to people who don't understand what's going on or need various assistance. Could be medical errors. It could be an emergency department or hospitalization or death. Next slide. Okay, so you are receiving home and community-based services. You are not happy with the care that you're getting. Maybe your person-centered plan isn't being implemented the way that you want it to be implemented. Maybe you are not allowed to have visitors at the time that you want to have visitors. Maybe you're not allowed to have a roommate of your choosing, but you have to room with somebody that you don't want to room with. So how do you make your complaints known? To whom do you complain? What's going to happen with your complaint? The proposed rule would require states to set up and manage and operate what's called a grievance process. So you can file your complaints about the services that you're receiving or not receiving. So what the grievance process has to do is have a system for somebody to file a complaint. They have to have a system for the state to investigate and respond to the complaint. The state has to keep records and keep reviewing the information they get about the grievances to make sure that grievances are resolved and they're not ongoing. And the states have to be able to share the information that they receive about grievances and the records for the grievances with CMS, which is the federal agency that oversees the Medicaid program. Next slide. And again, this gives more information about a grievance process. It gives a person a way to notify or tell their state Medicaid agency when they have a complaint about how a provider or a state is meeting the Medicaid services and providing them. Next slide. Okay, quality measures. What we think about is not only do we want you to receive home and community-based services so you can stay in the community, we want to make sure that those services are really high quality. Think about it. If you go out for a meal to get a hamburger, you want to make sure that the hamburger that you receive is tasty and a good quality hamburger and that you're able to enjoy it. So the same thing with the home and community-based services that you receive. So what the quality measure proposed would require states to use certain quality measures that are used by other states and that have been recognized to meet high quality standards. And states must set goals for meeting their quality standards on a yearly basis, and they must report each year on the quality measures. States must report also on race, ethnicity, tribal status, sex and age, whether the person is in an or rural or urban services, whether what disabilities they have, what languages they speak, and other factors. So we have a sense of who is receiving home and community-based services in each state and throughout the country. Next slide. So this slide talks about how you can make your voice known, how you can provide comments on the rules. I'm not going to talk a lot about that because Delaney's going to explain the toolkit to you all later. The important thing to know is the deadline for comments is July 3rd of this year, so that's only a couple of weeks away. ACL has tried to provide information about the rule in addition to doing these webinars. We have a blog that we wrote that tries to explain the proposed rule to self-advocates and advocates for people with disabilities. It was published on April 28th, and you can find it at our website, which is acl.gov. Next slide. And I am ready to take questions and discussion. Thank you for the opportunity to present.
Thank you, Ms. Gottlich, for your presentation. I do see a couple of questions in the chat. The first one is regarding the proposed 80% compensation requirement. Would that apply to residential supports, such as direct support workers who work in provider-owned home or host homes where people with disabilities live and the homeowner provides personal care?
Yeah, the 80% applies to different kinds of settings and different kinds of workers. And you may want to read that provision pretty closely, and you may want to comment on that provision.
Okay, and question 2 is, does the rule have a built-in enforcement or accountability? For example, Vermont is not in compliance with the settings rule or person-centered planning rule.
The rule talks a little bit about compliance. I think that, again, that's an area where you may want to provide comments if you think that CMS could do more on enforcement and, talk about some of the out of compliance areas that you have seen.
And another question is, how do states address variations between fee-for-service and managed care?
That's a very good question. There is a separate proposed rule relating to managed care. These provisions, the access rule provisions, apply to fee-for-service as well as managed care. Managed care already has a grievance procedure, so states don't need, if this rule becomes final, states wouldn't need to establish a new grievance procedure for managed care. The grievance provisions apply only to fee-for-service.
Okay. We have a few minutes left, so can people put any final questions in the Q&A box?
Grievance procedures and appeals the same. They're similar, but not quite the same. So you could use a grievance procedure to say, I'm not getting all of the services that I should be getting, or I'm on the waiting list too long, an appeal would really be for a denial of coverage or eligibility. Okay, so if you're not eligible for home and community-based services and you think that you should be, then you can appeal that denial.
Okay, we're going to move on to our next speaker. We can follow up with Ms. Gottledge in a separate email. Now I want to turn it over. Well, thank you, Ms. Gottledge, for answering those questions and for your presentation. Now I want to turn it over to Emmanuel Jenkins to do our interactive workshop.
Unfortunately, it looks like we just lost Emmanuel there. Vicki, while Emmanuel comes back, there has been another question that's come up in the chat here about hidden wait lists. Is that something that you can speak about?
Yes, and I think that is something worth commenting on in the proposed rule. There are no service providers, as the chat says. Somebody's found eligible, but there aren't any service providers, or providers are not taking new clients. And that's something that you might want to consider suggesting, that states be required to provide information on and keep data on.
Can you guys hear me now?
We can hear you now. You're back, Emmanuel. Thank you.
Sorry about that. I don't know what.
The floor is yours.
All right. Thank you so much for your presentation. What a great quick overview of the ruling. Now we want to hear from you, the participants that are listening today. So we're going to launch a couple poll questions. The first two questions should be get ready to pop up on your screen, and while you are answering those, I'm going to introduce you to a couple colleagues of mine that will be sharing their experiences today. Then we will launch 3 more questions as we go through this conversation today. If you're unable to answer the poll questions that are on your screen, do not worry. We will email you after this webinar and a follow-up email with tons of good stuff. And the poll questions will be part of that email. So if you are unable to answer, just wait for the email to come your way, and that way you will be able to fully participate. All right. So we have Maitri Campbell and RT Mays with us, and I'm going to start. My first question is for Maitri Campbell. Maitri, can you share a little bit with us about the process when you reported an incident regarding your personal experiences with people providing your care?
First of all, the process of me living in a community was rough because it took 3.5 years because they haven't heard of this. They don't have the services set up, so I had to start it from scratch. I would go to legislative hall every day for 2 weeks. I would sit there until a legislator talked to me. Because my services wasn't a state requirement for somebody to live in the community. So, and I had to wait for housing.
So Maitri, will the new ruling help you now that you live on your own in your own apartment? Will the new ruling help you when it comes to the grieving process? When you have an issue with the people that come in your home, will the new ruling help you relieve some of those fears when you report people for not providing the proper care that you need?
Well, that is, I reported, but most times I'm not being heard. They just sweep it under the rug.
So the new ruling will help you not allow them to sweep it under the rug. Is that what you're saying?
Yeah.
Yeah, absolutely. Thank you so much for that, okay?
Yeah.
So the next set of poll questions should be about to appear on your screen. And again, do not worry if you are unable to answer the poll questions as they appear on your screen. This time, there should be 3 questions instead of 2. And while you are answering those, I will now turn my attention to Mr. R.T. Mays, who is also another DDC council member, Delaware DD council member. Mr. R.T. Mays, my question for you, one second. With the new ruling requiring that the provider checks in annually to reevaluate your personal care plan, does your provider currently review this plan with you? And if so, how often do they do it? And do you have a chance to modify or make changes to that plan currently?
Yes, the provider does come to the home every 90 days to go over the plan with me, and she asks, is there any changes I would like to make? Is there anything Is everything okay? Is everything going okay with your services? So the provider is very much hands-on with the plan. So.
And that's your person-centered plan, correct?
Yes.
All right, thank you so much.
Mm-hmm.
I believe that is all my questions, and now I will turn it over to our next speaker to go over the new toolkit. And again, thank you guys for allowing me to facilitate this discussion with you. Please take it away.
Hi, thank you, Emmanuel. Hi, everyone. My name is Delancey Allred, and I am the policy coordinator at the Autism Society of America. I want to thank you so much for joining us today at this workshop so we can learn about this rule and how it will impact the disability community. So we really hope that this workshop inspired you on the rule and how it would impact your daily life. And so we put together, the Autism Society and NACDD put together a toolkit all about the rule and how you can comment. The toolkit describes what the access rule is that we have been talking about for this meeting and how it will impact the disability community. And then at the bottom on page 3, it links you to the action alert, which is on the Autism Society's Action Center. This action alert will allow you to easily send a pre-written message on commenting on the rule. It goes into the 5 parts, and it also provides guidance on how you can personalize the rule. It's very important that you personalize the rule and provide stories on how the rule will impact your services. We will make sure we send the links in the follow-up email to everyone, and I'm also going to put the links in the chat. And if you have any questions about the toolkit or the action alert or have any problems along the way, you can feel free to email us. And you can email the email that you got about this workshop, Eric's email, and he will make sure to forward it over to us so we can help you. Again, it's very important to comment on this rule. We want the ACL and Medicaid want to hear about how this rule will impact us. You know, this is only the beginning step of the process. And so right now that they put out the first notice of the rule, they can edit it along with how we comment. So it's really important to make sure our voices are heard. Oh, and Eric said this toolkit was received in an email yesterday too, but we will make sure to also include it in our email today. Emmanuel, do you want to say a final thank you to everyone?
Thank you everyone for joining us. I really hope that you come away from this webinar with the tools, no pun intended, to really allow your voice to be heard. This ruling is for the people. So we really want your voice to be heard, and what a great way to do that. And again, thank you all to the rest of the speakers for allowing me to be part of such a great panel today. I look forward to doing this again in the near future. Thanks everyone, and have a great day.